Hey guys, I just want to talk about a couple things before class this week and before you start on pre-class work. The first thing I want to let you guys know is that this week and next week we will be going over the traditional sensory motor techniques. So we will be focusing on 4 different techniques, 2 this week and 2 next week. One thing that I think is really important for you guys to keep in mind when we're talking about these techniques is that they required lots of continuing education and certifications, and they were really kind of the gold standard. You were the best neuro OT if you were using these techniques closer to when they came out, but most of these techniques were developed like in the 40s and 50s, and our research has kind of gone in other directions since then. So keep that in the back of your mind that like people don't come in and say, I'm going to today we're doing NDT in our treatment. Therapists pull bits and pieces from each of these frameworks into their sessions, but it would be very rare for you to see a therapist that does this is going to be per the protocols of these different approaches. I am also going to have you guys looking up the research. I just want you guys to each find an article that supports or does not support the 2 different approaches and bring them to class. Read them, kind of have an understanding, so that way we can have an informed discussion about what the research says we should or should not be doing. And we are going to try something new. I know you guys have tried it once in PEDS, but we are going to be doing a voice thread. It is not graded because I have not used it yet, and I want to work out the kinks before I assign any points to it. So just consider it a learning activity. I do expect everybody to participate. I have 2 different voice threads that I have included in the assignments folder. What I want you to do is just to add one video to one of the slides that somebody else hasn't commented on. Now, there will be more of you than there are slides, so once all the slides are full, if you are later to post, that's okay. Then comment and do something different than the person that posted on a different approach. So, for example, I might have a technique that says key points of control. So maybe one person did a video on facilitating anterior, posterior, pelvic tilt, or show different pictures on different points of control. Just pick a different part of the body to do a video on. This is really just a way for you guys to get an understanding of a group of all the different techniques without getting lost in tons and tons of videos. We will talk about more of these techniques in class, but this is just a learning activity and a starting point and something for you guys to reference. I'll be checking them to see how you guys are doing as we go along. You can look up different YouTube videos, you can look at your textbook to add to the video. Again, I'm not grading you on the quality of your video. I just really want you guys to actively engage before we come to class so we can have a really good discussion on these techniques and also practice some techniques that I think are valuable using in the clinic setting still. If you have questions, please reach out. I am always here. I am always happy to support you. I am always available for office hours, and I look forward to seeing you guys this week in class again.